resources and media platforms
to shine a light on your brand.
Apply now at allinforequity.ca.
allinforequity.ca.
This is Rogers TV, Gray County.
Hello and welcome to this special edition COVID-19 Rogers TV program. My name is Carol Merton, and today I am delighted to welcome as a guest Dr. Ian Arra. Dr. Arra is the Chief Executive Officer and the Medical Officer of Health for the Grey Bruce Health Unit. Dr. Arra, thank you for joining us today. Honestly, who would think? We're having ongoing conversations over numerous months. Nothing personal, but it will be a cause for celebration when COVID is not the topic of conversation between us. Thank you for being here today. I'm wondering if you can provide an update for those who are viewing on where we are and what you'd like us to know as we move through this pandemic.
Thank you, Carol, for having me. It's always a pleasure to be here. And indeed, it will be nice to have a different topic, hopefully, in the near future.
Yeah.
So since we spoke last, we've seen a drastic increase in the number of cases in Grey Bruce. And that has been consistent with the provincial picture as well. Omicron, as a new variant, has high level of transmission, where the strategy has to change from containment to mitigation. And I will explain what these terms mean. Containment was a strategy for the previous 2 years, almost 2 years, where our goal is to keep it close to zero in between waves and to minimize the waves as soon as possible and to the best of our ability to protect the healthcare system. And we've done this very nicely in Grey Bruce. With Omicron, doubling time of less than 2 days means anytime we find a case, they have already been shedding the virus, potentially or practically infecting their family, their friends. And by the time we find them, we try to case and contact trace the people around them that have already been infected. So containment is not the strategy in this case, rather to ensure we slow down the progress of the pandemic. There is a bright side to this Omicron, as the fact that it is not as severe as the previous variant, specifically the Delta. Delta would have been way more of a problem to deal with for a longer time comparing to Omicron. Omicron helped us clear Delta more or less, or it cleared it. However, we're still not out of the woods yet because Omicron is highly transmissible, which means even though the number of people who might end up with severe complication and ending up in a hospital or requiring ICU is a very small fraction of the people infected, just because of the sheer numbers of people who will be exposed and infected, the health care system, the hospital system will see pressure, and we've seen this over the past few weeks. And that's where there was the direction from the ministry and from the province to have a surgical closure to certain sectors, and surgical in the meaning that it is focused on and short term, and that has been done, and the announcement recently from the province to lift these restrictions in the imminent future is just part of the plan, and I believe it is a measured approach. During the past few weeks, few other things happened as well. One of them is direction from the province to health units to focus on long-term care on high-risk settings, including long-term care and congregate settings, hospitals, and first responders. These are the sectors that are most vulnerable, and these are the sectors where we need to focus our effort. Nevertheless, in Grey Bruce, we've maintained to this day following up with every case in the community, regardless whether it is related to the sector or not. And in this case, we call the specific case when they receive the report, and we do an early triage to see if the case is a worker in one of these sectors or a close contact, family member or friend of somebody who works in these sectors. And if that's the case, we conduct the full management of the case and the contact. And if it's not, we refer the case to the provincial task force. And we've also utilized certain technology like texting and online registration for cases, and that would allow people to manage themselves according to the protocol itself. And if people don't use cell phone or did not respond to our automatic texting system, we will reach out by phone, so nobody will be left without follow-up. In the focused high-risk groups or hospital, long-term care, first responders, in Grey Bruce, we've seen increase in number of cases in all sectors, including these. Nevertheless, at this point, we've been seeing that the data is plateauing and coming down, which is very reassuring that we are on the descending part of the epi curve. The epidemiology curve has a bell-shaped curve for any pathogen, and the sharp increase with Omicron will be consistent with a sharp decrease. And this is what we're seeing locally, but also what is announced provincially and from other provinces as well. So all in all, we have these three main high-risk sectors, and they are all in relatively good standing relative to other parts of the province. We connect with other medical officers of health. In the police, fire, and EMS, and the essential services, including Bruce Power and other essential services, we don't see at this point any outbreak. For hospitals, there is a minor outbreak in one unit at this point. There was one that was cleared a couple of days ago. So that is a very good standing for this wave. For long-term care and congregate settings, we've seen a sharp increase in the number of outbreaks. We currently have around 10, which is a number that we're not used to in Grey Bruce. And unfortunately, we've seen 3 deaths since the New Year's, and those are the only 3 deaths in long-term care in Grey Bruce. We've managed for 2 years, almost 2 years, without having that unfortunate outcome, but recently we have experienced that. Nevertheless, if you compare the number of outbreaks and the significance of them, not all of them are, most of them are actually minor in nature. And if we compare it to other parts of the province, I know of at least 2 health units who said we need prioritization criteria for managing outbreaks in long-term care, because keeping up with all these outbreaks was not possible with the capacity they have. We do have capacity to manage this, and we are definitely working with the long-term care. And it's worth mentioning there, shout out to long-term care retirement homes and congregate settings. These people are burning the candle at both ends. They're at the front line where they're themselves exposed or potentially exposed, and if it is for their expertise in using PPEs and other IPAC measures, infection prevention and control measures, we would have not had the good results we have in Grey Bruce. Yeah. So in general, in Grey Bruce, we remain relatively in good standing, and we're seeing the numbers plateauing or coming down, and I can go into the indicators if there's interest there, but in general, we are on the tail end of it, and hopefully with the more vaccines provided and with natural immunity for people who chose not to get the vaccine but got the wild virus, we will be heading towards endemic at some point in the near future. My own prediction, 4 or 5 weeks to end the wave, and then the restrictions will be lifted as we go. However, this pandemic is humbling, and we've seen the Delta completely an exception to the rule with a more severe virus. I'll stop there. I'm sure you have questions than what I mentioned, but I'll be more than happy to try to answer.
I promise not to hold you to that time frame, but it does give me hope that over the next few weeks, the horizon looks more promising. And we do understand circumstances can occur that are beyond our control. Couple of things. I think it's remarkable that the Grey Bruce Health Unit has continued to do the contacting of individuals whose test results have come back. Not every health unit has been doing that, correct?
Correct, yes. The provincial direction is to only focus on cases that are in high-risk setting, and all other cases will be managed centrally through a website or task force provincially. But any time we see that we can ensure that we are following up with our own residents, we ensure that a case will be flagged if it is related to long-term care instead of sending it to the province. And I trust the province have their own processes, but we do have the capacity and the expertise, and we've delivered.
Yes, and it's great because there is a sense of comfort in knowing that there's still that connection with the Grey Bruce Health Unit with our community, and I think that's remarkable. So I have just a bunch of little questions, which may lead into a deeper topic for you, but the vaccination clinics and the hubs, we were going to chat briefly about Bruce Power and their contribution to this, and I wondered if you'd like to speak to that now.
Most certainly. Vaccination is one of the components or one of the tools we're using to manage this pandemic, and they've performed very well before Omicron and during Omicron as well. But with Omicron, we need a third dose to get a level of protection of around 60-70%. 2 doses have been, according to the science table and other sources, will protect around 20-30%. So the key for the past 2 months is to ensure a third dose is in arms. And to that end, we had to move from the regular or the modalities of delivery of vaccine that we have to mass immunization. And that we set up 3 hubs in Grey Bruce. Bruce Power has been instrumental in setting them up within days. Even the last one in the Bayshore was set up within 1 day. And that's to accommodate ensuring that the facility is used by the community for other activity and not used until the last minute that we need it. And Bruce Power team and leadership has been instrumental throughout the pandemic. This is just one example, and it's definitely a significant outcome for the whole community to protect life. We have, Carol, at this point, over 40% of our eligible population received 3 doses, and the provincial average is 34%. So we are in a leading group, definitely. Many people look at the 1 dose and 2 doses, and we are not in the lead there. We're actually close to the very bottom, but we need to remember that 2 doses provide 20-30%, and the money is in the 3rd dose. Plus, that's a question that comes to me quite often, the difference between among health units. There are less than 10% point difference. It does not really change the significance and outcome. And we've seen the outcome in Grey Bruce in the safety, relative safety, and whether it is number of hospitalization or number of death. And that leads into the perception of risk. And this is where there's a message there for all of us, for our audience, that although we have relatively a safer area, there is still risk. And the 3rd dose is recommended. And if people didn't have their 1st and 2nd, it's never late to get a vaccine. People look at our numbers and see that didn't experience the large number of deaths in long-term care or in congregate settings that happen in other parts of the province. And risk perception is definitely part of the decision-making for people who are on the fence, who are hesitant about getting the vaccine. So we have been the victim of our own success in Grey Bruce when you say, well, we need to up the vaccine coverage, and many people might look at it's not as risky. I want to remind everybody that we're still in the woods, we're not outside of the woods, and we all need to do our part to protect the community, whether by getting the vaccine or being extremely vigilant in the coming few weeks.
And that's really important information because statistics can be interpreted in so many different ways, but it's looking at the whole picture and the whole situation that helps make informed decisions for sure. Now, we are certainly seeing higher numbers, and we've heard that surgeries are canceled at this point, just perhaps paused is a better phrase, because they will resume once the system can accommodate the load. And although Omicron is, in quotes, less severe, for some it's still a death sentence. And I think recognizing the high-risk people, that it can make the difference if they catch it of dying, and those are our people in the long-term care facilities, among others. So it's significant still to recognize that it has that impact on people living or not living, and that's important. So did you want to speak to that?
Yeah, Carol, that's a really good point. What you just mentioned actually triggers. I had a meeting with the chief of staff from the 3 hospitals just yesterday, and they described the ICU as at a state of being busier than any other time during the pandemic. And it is unequivocal fact that all the ICU patients at this point in Grey Bruce are not vaccinated. So it is the people who are out there who have not received the vaccine that need most protection, and we'll do our best, whether it's through the antiviral therapy that is recently approved, or hopefully through the vaccine, if people can spend some time, invest some time looking at the safety and efficacy and these numbers from credible sources and get the vaccine. And we do have access in Grey Bruce. I need to circle back to that part where every other health unit I know of has a plan of providing the 3rd dose over the 2 to 3 months, January, February, March. We completed this task in 2 weeks. Today would be the last day for mass immunization, and we provided a spot or access to every single person who's eligible for a 3rd dose through mass immunization. And on top of it, we have the community clinics. We have 19 community clinics, 1 in each municipality and 2 in the First Nations communities. And we have support to pharmacy that is committed to primary care in different parts of the area. So again, access is available, information is there. We're just encouraging people to take a look at data.
We've heard the phrase COVID fatigue, but recently I'm starting to hear the terms vaccination fatigue, where there's an attitude, well, I've gone for 2. I don't know if I want to go for a 3rd. If it can't work in 2. So can you please elaborate on the benefits of that 3rd vaccine and why it may be necessary, and whether we need a 4th one?
Right. So yes, definitely there is COVID fatigue, and there is messaging fatigue. More specifically, vaccine. I don't see it fatiguing in any way. Somebody received it, because it is a passive way of protection. Passive is a very positive term here. A person gets it, and my family doctor actually said, did you have any side effects after the vaccine? I said, not anything significant, sore arm. So he said he did get the vaccine, and his only side effects was relief. He felt relieved. So there isn't much fatigue after it, but I can understand about the fatigue with messaging about vaccine. And we definitely see that Omicron is not as responsive or covered by these vaccines. Nevertheless, that's for transmission. For severe disease and hospitalization, the data is very clear. People who are in the ICU are mostly people in Grey Bruce. All of them at this point are people who are not vaccinated. In the province, you would see among hospitalized and ICU 50-50. But we need to remember that that's 50% of these cases in a hospital come from 90% of the population. So the proportion is what matters, and that number could be misleading. The protection from severe disease, from hospital admission, from ICU is unequivocal. The vaccine is protective. Having a third dose will prevent the transmission to a certain degree, 70%. It's not perfect. Herd immunity was a goal before Omicron. With Omicron, herd immunity is not going to be achieved just because you need 100% of the population vaccinated with a vaccine that's responsive to Omicron, and we don't have that at this point. Nevertheless, as I mentioned before, the Omicron itself is not a severe, is highly transmissible. So many people will be infected, and hopefully they're going to be infected after getting the vaccine, so they're not going to be suffering from severe disease.
Right. I know we've talked about Omicron and being less severe if you're vaccinated potentially, and life or death situation. But there's another part to this COVID-19 virus, and that is the residual effects after people get over the acute. We either think of, well, I've had it and gotten over it, but we are learning that there is a longer term effect for some people around having this virus that can affect their life ongoing. Could you talk a little bit about, I think the word is long haulers, so that people are aware that there's another part to this virus?
Yeah, definitely. From early on, there were reports of people who remain symptomatic, not specifically with the acute disease, but with headache, fogginess, fatigue for a long time, months. And as the pandemic progressed, more of these cases have been identified, and it is definitely not a good outcome. And the data is not there right now to see who would be affected by it. And from the data I looked at, or from the reports I read, it's not age specific, it's not gender specific, it's not health condition specific. What we know that vaccines will protect in general, and would reduce the chances of people getting infected with severe disease. Is the vaccine going to prevent the long-term COVID? I don't have the answer for that, but knowing that there is relatively a very simple remedy or vaccine, and it's available, I would encourage everybody to consider the vaccine, whether it is for the protection of the community, for the protection for himself, or potentially or possibly for the long-term effect of COVID.
I had the advantage of hearing you speak about masks the other day, and there's been some question in the community about N95 non-fitted masks and medical masks and cloth masks. I'm wondering if you could take a few moments just to give us your perspective about the differences and what you would advise the public.
Yeah, the recommendation from Public Health Ontario, that's a very key question, Carol. The recommendation from Public Health Ontario, which is a scientific body for public health in Ontario, has not changed with the recommendation for droplet precautions. Droplet means surgical mask or face cloths. Those are quite sufficient in the general settings. N95 will protect when the virus is aerosolized. Aerosolization is a specific term, happens whenever there is enough pressure, air pressure on the virus or the droplets that will make it float in the air in smaller particles. Those N95 is very recommended in these settings, but these are usually clinical settings, whether it is a dental office with the tools that they use, there's air pressure, or intubation in the OR or the ER. And in general, the use of N95 is in these settings and in the hands of people who are trained in using it. For example, Carol, whenever a person takes a mask, the N95 requires pressure on the face, so there is a rubber and recoil of the rubber. And if the person was not trained to take it off the appropriate way, that recoil is going to spread all the particles from the outside of the mask in the environment around the person when they're donning and doffing the mask. So it actually increases the potential risk if a person uses the mask and didn't use it appropriately. And those masks are usually used for a short period of time for procedures, an hour or two. It's not to be used throughout the whole day. And depending on the age of the person using it, if you go to kindergarten kids, there was a notion at some point about using masks or N95, and that definitely defeats the purpose, because anytime you have a bulky mask like N95, even for adults, we need to adjust it quite often and touch our face quite often. And with every touch, we're increasing the potential risk of transmission. So again, there is plenty of science out there, but at the same time, I realize there's plenty of media coverage that might be biased for one reason or the other. The recommendation has not changed for settings, general settings, even vaccine settings, vaccine clinics. The surgical mask is quite sufficient and adequate.
I know we have just a few moments left in the program. The news from the provincial government recently is about more openings. As our medical officer of health, do you have a concern about that, or what would you advise as things start to open?
I do believe this opening is very timely and measured. The intervention to have some restrictions or lockdown for a period of time, a couple of weeks, has been very measured and necessary. The only sector that every MOH would theoretically advise not closing is the schools. Yeah. However, we know that we don't only manage the risk, we manage the perception of risk. And you can appreciate if all these sectors are closed except the schools, many parents and school workers might be asking the question, how come am I at risk in the school? And we know in the province in general, and Grey specifically, we had less than 15 cases. We had actually 12 cases transmission within the class, 26 cases transmission in the sports related to school out of the 4,000 cases. And with that percentage, we know that our schools are safer than our homes. And you go back as a complete sectors, and the lifting of restrictions at this point is very measured, and it's part of the reopening plans.
Yeah. Well, we're all looking forward to the gradual reopening, and certainly remembering the 3 W's is critical. I want to thank you so much for being on the program again, Dr. Arra. We always cover so much information, and I appreciate you taking the time. Please take care of yourself, and also thanks to your staff as well as yourself for what you're offering to us in our community to keep us safe.
Thank you.
Thank you to our viewing audience for joining us today. Please join us again to learn more about resources and programs available to keep you safe in your homes and your community. Take care.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.